So hello everyone, welcome. So nice to have so many of you with us today. I'm Erla Magnúsdóttir, and I'm one of the co-chairs from the Catalyst Mental Health Collaboration. We're very excited to have this session here today. It's a topic that I think is very dear to many of us working in mental health. It's around community health workers selection, sort of a practical knowledge sharing session. So we will have both presentations, but we'll also have a chance to break out into breakout rooms. We really want to hear from you. It's about learning from each other. But we're very grateful to our speakers today, to Anita Kaslin and Teddy Sverauka, who are going to lead us today, and they are from they're working from the Anita is with Vita Plantner and Teddy with Swandiri, and they are going to they're also going to be joined by their colleagues Joy Bittner and Nicola Willis. So with no further ado, I want to just hand over initially to Teddy, who is going to do the initial presentation. So Teddy, over to you.
Thank you, Ella. Good morning and good afternoon and good evening, colleagues, depending on where you are joining us from. So let me just put my slides up. Right, I hope you can see my slides.
Yes, we can see them perfectly. Thank you, Teddy.
Great.
Yes.
Great. So I'm going to be sharing about our experience from Zwandiri. So we are working with young people living with HIV that serve as peer counselor or peer providers, so to say. So they are actually community health workers that work within the clinics and also within the community to provide mental health support to their colleagues that are on living with HIV. So to kickstart my presentation, as you can see, I've just extracted something from our standard operating procedure that we have, which covers the different aspect of the work that these community health workers are doing. And one of the key components that we are going to talk about, as you introduced, is the selection. So we have a comprehensive SOP that talks about issues to how do we go about selecting community health workers. And so these are some of the key areas that we look at, because we actually want for the people that are using it to be guided, so that it's a process that is more systematic and a process that is standardized in ways of doing it. So if we look at the what part, so here we are saying that we are identifying the community health workers. Then who are these community health workers, or who are we targeting? So usually it's young people that are living with HIV that are between those age groups of 18 to 22, and they also have to be living with HIV and on ART, and their viral load also has to be suppressed. And also we also look at these young people that have been at this clinic for some time or not, because of course when you are engaging someone to provide mental health support, you also want to pick someone who is well aware and who is really understood in terms of their HIV status and how to navigate different challenges that they would have encountered in terms of them trying to really get down to understanding their status. So those are the key things that we look for. And of course, when we look at the where part, where do we usually do this? So this is done within the health facility, where the Ministry of Health or the healthcare workers within a particular clinic, they really take a leading role, because they are the ones that really know these young people from for a long time, so they can really talk about different aspects pertaining to these young people that want to be engaged to work as community health workers. So when do we do it? So it also varies from within with the context and also the way the solution is being implemented. For example, sometimes we do it annually. In some contexts, they want to train maybe biannually, or they say after we've started the program, then after 6 months, they want to add another cohort of community health workers. So it then depends in terms of how the modalities of implementation are going to be structured. Then in terms of the household, like I mentioned, we do this with the Ministry of Health. They really take a leading role in that. Then we have comprehensive tools that support these community health workers selection. So some of them are like our eligibility criteria that we usually share prior with the team from the Ministry of Health or with the teams at the clinic, so that they really understand what kind of person we are looking for and how can they make sure that amongst the cohort of adolescents that they have that are on treatment, they find these young people. So this is from our SOP. So I mean, it's quite a comprehensive document. I'm sure if there's an opportunity, we could share some of these tools so that the colleagues on the call can also see how we go about it. Then the key attributes that we look at, of course, we are working with these community health workers that we call PA providers. But in most contexts, they are also known as the community adolescent treatment supporters, which is CATS, but it's essentially those community health workers. So of course, we look at to say their lived experience, because we are looking for someone that is able to provide their peers with mental health support. So they also have to be living with HIV so that they are able to also draw from their experiences and also as they support their peers. And of course, there's also that issue of readiness to support their peers. I mean, you realize and find out that these adolescents, they're at different levels of understanding their status. So we really look at that as a key component in selecting, or as a key attribute, because you also don't want to select someone who's trying to learn, or someone who have just gotten to know their status. They are just 3 months or 4 months on treatment. There are quite a lot of dynamics that they are still to understand about their treatment, and also in terms of acceptance, and also issues surrounding disclosure. So we really look at that to say, is this person also ready? And even when we go through the interview process, I mean, it's also something that we also talk about with them as we are doing the selection. And of course, issues to do with character, because you are looking at young people that are in the community, so they are going to be supporting their peers in community. So they are going to encounter a lot of different people. Sometimes they are going to encounter some adults, the caregivers that are working with these adolescents. So there's also a need for that, to look at that, to say, what kind of vibe is the person that we are getting having, so that this is a person that is able to also come down and really talk to this adolescent or to this young person, but also at the back of their mind, they also have that that thought that, you know what, at some point I'm also going to engage the caregivers that are for the children that I'm working with. Then of course, communication skills, it's key. Of course, you are going to be communicating for the rest of the work that you are going to be doing. So I mean, we also need someone who is able to really also express themselves while they are supporting their peers, because then there's also issues to do with, as you work as community health workers, we know that there are certain tools we need to report the work that we are doing. So there are certain tools that they use in the work that they are doing. So I mean, having some knowledge or having a literacy level really helps for you to be able to grasp these tools. Yes, they are simple tools, but you just have to have that skill to be able to maneuver tools and use them to support the work that you are doing. Then the other key thing that we look at is the support system from home, because we really want them to also be supported while they are also supporting their peers, because, you know, we are talking of mental health. So I mean, you can't really take someone somewhere where you've never really been in terms of mental health. So you really need to have also that supportive environment so that you can also effectively support your peers. And of course, this work, I think we would all agree that it really hinges on a lot of confidentiality. We really re-emphasize that a lot of the time that we are doing the selection for these community health workers, to say, you know what, the work that we are going to be doing is you are going to engage with different recipients of care that have different needs when we are looking at mental health. So we really need to be that person who is able to take care of those issues of confidentiality and not end up sharing some of the things that you are actually trying to provide support for amongst the peers that you are working with. Then, of course, some of the success factors that we have noticed over the time that we have been implementing the solution is that you would see that if government is really engaged meaningfully and is really involved fully, this really helps in terms of especially the community owning the program, because the community will say, no, these people, they are actually coming from us, and we really played a crucial part in selecting them, because, you know, they are the healthcare workers who selected them, then we put them, so they are working to support our children. So if that is done really well, it really helps in terms of providing sustained mental health support for the young people that are living with HIV. And of course, they utilize the referrals from the support groups, because, you know, the nurses, like I said at the beginning, they've been working with these young people when they were in support groups from a tender age. So they really know who's who, this one and this one. So there's that type of relationship that they have. So it's really good to tap into that indigenous knowledge that will be there at the clinic to really find out, to say, okay, when we are doing selection, these are the preferred items that we are looking at. Then I think we all know that, you know, our community health workers, they are really doing a lot of work, and, you know, issues of compensation, we always talk about them, but of course, different models are limited because of different support that they receive in terms of the different funding mechanisms that are there. But at the onset, I think it's always good to just be open and honest to say what are they really going to get, so that they really know from the onset, when they are starting to say, okay, for this program, this is how things are going to be like, this is what I'm going to get. Am I going to get a bicycle? Am I going to get a phone? Am I going to get some funds for airtime, for talk time, and things like that? So it really has to be something that is really comprehensive at the beginning, so that you don't overpromise them something that you are not going to deliver as the program is actually going to go on, because they will really hold you accountable to say, but you promised us this. So you really have to be clear at the beginning. Then, of course, you know, because we are working with adolescents, isn't it? They are growing, and they're going to mature and get into the adult cohort. So it's also important for you to say, depending on how your community health workers that you are working with, depending on, are you saying there's a graduation after 5 years, there's a graduation after 2 years? So it also has to be something that is clear as you are selecting them, to really tell them, to say, you are going to be a community health worker, but this is going to be for a period, maybe for 2 years, maybe for 3 years, so that you also prepare them for the next step that they really have to do. So we have different graduation and transition plans that we put in place as they really transition from being an adolescent into the adult cohort. So depending on what type of community health workers you are working with, you really need to think thoroughly about issues of transition or issues of graduating, to say, okay, how is it going to be done? Then, as I mentioned, also on issues to do with readiness. So this is where we also do the mental health screening of the community health workers, so that we really also see where they are at, and those that need support are referred to receive support, so that once they start working, or once they undergo the different trainings that they have to go through, they are really prepared in taking the work, and also the workload that it comes with. Then, of course, on issues to do, like I was mentioning, issues to do on literacy, we also have an assessment test that we also go through with them when we are doing the community health workers interviews. So we go through that then we administer the test to see also their level of literacy. Then, of course, we do home visits for them, for all those that will be shortlisted for the interview, so that we see their living arrangement, their family, their support environment. Then we also do that after the selection, so that we are able to then meet with whoever they are living with, to also sensitize them about the word, also maybe in the community, so that they really have a clear picture of what the community health worker who is coming from their family is going to be doing. Then some of the challenges that we have been noticing over the years that we've been implementing this model is that not everyone is interview ready. I mean, some of these young people, they've never really been on an interview panel. I mean, they have no clue what to say and things like that. So you really need to be aware of that, because sometimes you can actually miss a good candidate just because that they did not do well in the interview. So there's also need to factor that in, to say, okay, yes, we are doing interviews, but they are also, not everyone is gifted, especially when we look at the young people that we work with. Not everyone is gifted in answering certain questions that have been posed to you. So there's really need to also have that at the back of your mind as you are doing the interviews or the selection. Then, of course, sometimes you would see that the facility recommendations or the clinic recommendations sometimes can be a bit biased, because someone likes a certain young person and they think, no, this one will do so well, and they're brilliant and they're nice. It's just that young person that they used to just like from a long time ago. So we really need to also, those are some of the challenges, but we really look at that to say, okay, we also need to be objective when we are doing the selection, and when we are engaging with the health workers that are doing the selection, the prior, before we do the shortlisting for the interviews. Then, of course, other prospective candidates also may not have documentation skills. Like I was saying, they might not be good at writing, they might not be good at using the different monitoring and evaluation tools, but generally they are good at providing support, because we are really looking at to say, is this person able to provide mental health support? So you see, some of them, they are actually good at that. They can talk well, they can engage with the young person more, but what is just lacking is those documentation skills. So those are also some of the challenges, depending on what setting, or maybe depending on the different, because different countries have different literacy levels. So you'd see that other countries are doing so well in terms of young people understanding certain things. In other countries, they are at a certain level. So you really need to also be aware of some of those. So that has also been a challenge when working with these young community health workers. So I think sometimes it's difficult to find someone who ticks everything in the box. But yeah, I mean, it can be done. And we really need to just have those things at the back of our minds to say, when we are going through the selection, there are other things that we really also focus on, instead of just focusing on what we have down or that we have written down. So it also gives us a way to be flexible when we do this selection. So thank you so much. That's the end of my presentation. I will hand over to Anita.
Hi everyone, thank you Teddy, lovely presentation. I hope everyone is fine. So I'm gonna start sharing my screen so you can see it. So welcome from Vida Plena. I'm Anita Kasling. What we do with Vida Plena is working with people that have depression in low-income countries. So I'm going to talk to you about a little bit about our experience in selecting community health workers. So here in Ecuador, we did it with two cities, Quito and Otavalo, are two very different cities. And instead of focusing on formal qualification, we prioritize soft skills like empathy, listening, and non-judgmental attitude. Our goal was very simple. It was to find people who truly connect with other people, not just with professionals with impressive resumes. So through the trial and error, we developed a selection process that highlighted the qualities that matter most for us, at least. So I hope you find it very useful. And we're going to continue. You're going to see our team in the photos, so I hope you really like our photos. So what the key attributes we looked for were empathy and active listening, the ability to understand and genuinely care about other people, like really connect. The other one was non-judgmental attitude. We didn't want people to give advice, but just really listen and support and create like a really good system to support other people and their community. The other one was commitment to social impact. Past volunteering or community work show us that they truly dedicated to help others. Like maybe you have a job that was trying to connect with people, or maybe you're doing volunteering in your free time. That was really important to us. Like they show that it was not just another job. And the other one was effective communication, a warm and clear way of speaking, making people feel heard and comfortable. We work with people with depression and anxiety, and for us, it was really important that those people were feeling comfortable and they were feeling listened, because here at least in Ecuador, when you go to a mental health worker, it's like you have 50 minutes to talk and you just don't get what you really need. So what we did to identify those people, we do our selection process. So I'm going to talk about first what worked and then what didn't work for us, so you can choose what is better for you. We experimented with different methods, so let's see what worked. So the first one, the step one for choosing people, it was using like Google Sheet questions, really simple, so everyone can join, everyone can read it. This helped us see their motivation and ability to express themselves. It was really quickie. We have a lot of responses, as you can see, and that was the first step. So we can receive people and we can check like basic things. After that, we went to the step 2, and it was to see emotional intelligence. So we sent a video from Pixar. It's called For the Birds. I hope you can watch it sometime. It's really cute. And then we send and ask the questions about emotion and social behavior about this video. So this was very effective because it revealed how well they understood emotions in others. So they have to watch it and then they have to send us like the responses about emotions. It was used in audio-based submissions. Some of the people sent videos that was really, really lovely. Some of the just audios, and we listened to them. So we didn't want to have like just written task. We asked the candidates to send voice message with their answer, because that allows us to hear their intonation, rhythm, and warmth, things that are impossible to judge in written text, and more when there were people that sent us a video. It also removed the barrier of writing skills. Maybe some people didn't have like a really good skills on that, and making the progress more inclusive. So that was our third step that was really helpful for us to kind of connect with the people we want to hire. So we met them a little bit more, see how they speak, know them a little bit. And the step 4, that was the long one. In the interview, we made role playing. So we use a role playing exercise to see how they handle real life situations. So we have like a case that we introduce to them. We play the role of people with depression or anxiety, and then they have to handle that situation like a 5-minute things. So this was crucial to test their empathy and ability to connect in practice. Like we really want to see them, not how well they know how to deal with depression, but like really basic things like not judge, have empathy, don't give just advice, and see how they respond, like their body, their language, their ability to communicate. That was the thing that worked for us, that showed us people that were really interested in working with people and getting to know them and was comfortable working with these things. What actually didn't work is not everything we tried was successful. We have candidates that like a task to identify emotions from facial expressions, but it really didn't work. It was like a lot of faces with options to choose, like this face, like you can see, and there was options like she's happy, she's worried, she's angry, she's whatever, and you have to choose the right one. We see that it was a lot of range of answers. Almost anyone can like put the right thing, or maybe it was like too confusing, or the face just expressed like a lot of things, or for people were a lot of things different. So it didn't reflect their actual ability to understand emotions in conversation. So after the first one, the first try, we eliminated that from our process because it didn't give us like a really good experience for choosing people. So it was making a longer situation to qualify, so it was just eliminated. The lessons that we learn through this process, we learn valuable lessons. First of all, traditional credentials don't predict success, soft skills do. We really think that professionals, of course, can give you a lot of experience, a lot of with things, but our goal is really to connect. So sometimes people that are just not with traditional credentials are quite better for this job. Creative assessments like the video analysis and voice messages reveal true emotional intelligence. So we can really see this from the beginning. So we can move on with the people that we think are the best. Role playing is one of the best ways to test empathy and communication, and we can adapt it to everyone, and we can do it more than once. We did it 3 times in each interview, so you can really see how people are going to react. And the best community health workers don't judge or give advice. They listen, they support, and they connect. That, as I tell you, it was what we needed from the people we work with. So by selecting these community health workers based on who they are, not just their qualifications, we ensure that communities receive care from people who truly understand and respect them. So that was for Vida Plena. We are going to continue making these selections. We're going to try to make it better. And if you have anything you want to ask or you want to say, we're going to hear from you. So thank you for listening. I hope you enjoyed this part. So I'm going to get back.
Thank you so much, Anita and Teddy, for those wonderful presentations and to bring all of your experience and share with us these practical tips. We are going to go into 4 breakout groups now, and please do stay with us. I know some of you might be joining from your mobile phones or something, and it might be slightly harder to contribute, but please then just listen in, contribute as much as you're able to. It would just be great if all of the facilitators of the groups, so maybe just Joy and Nicola, if you can kind of, yeah, we probably don't have a lot of time for introductions, but just sort of waves so people know who you are. And Susan, I think you are all set to set us up in breakout group.
So we needed more time. That's clear. It's a hot topic. We've got lots to share.
Yes, it is. I was closed before we finished. But yeah.
Yes, we definitely needed more time, but some really good conversations. Hello, everyone. Welcome back. I hope you had managed to at least sort of scratch a little bit the surface of the topic. We have a Q&A session now. I realized we didn't have time for Q&A before with the speakers, and it can be either aimed at our speakers today, or it can be based on your breakout sessions. Let me just start off because we just had a question from Brian. I don't know, Brian, would you be willing to ask it to the group just as we were taken out of our breakout group?
Sure. Yeah, I was just wondering about any learnings that you might have taken away from times where you've hired people or sets of people that you thought were a good fit for the organization, and then you find out after maybe a little bit less so. Did that, how did you handle the situation? What did you learn in that you could apply to future hiring situations?
And Brian, are you particularly thinking of community health workers then in this context?
Yeah, I guess I guess it can be any
Yeah.
mental health context, but sure, yeah.
Great. I wonder if Anita, Teddy, Nicola, Joy, would you have any thoughts on that?
I can give a bit of thought from Jandiri's side. At any given time, we often have up to sort of 3,000 young people as peer counselors in Zimbabwe. And it would be a miracle if we selected them all correctly. And I think that can come both ways. It can be that we thought we'd found someone that was really ready and wanting this role and has the skills for that role. But it might also be the other way, that the young person thought they were coming into something that it wasn't what they expected. And that's why, Teddy focused on, being very clear from the outset, as far as we possibly can, to help this young person know what they were getting into. But there are definitely times when we've had young people who it just wasn't for them. And there could be all sorts of reasons for that. And it is not easy at all, letting go of any sort of paid employed member of staff. We're talking about letting go of a 19-year-old volunteer who may or may not have been putting a lot into this role. And we have to, a great, we from the beginning, we work very closely with the ministry, very closely with the clinic. And we will intensify support if there's a problem with their capacity. And it's, we put that on our side to really step up the support, to really try and help them acquire those skills, acquire those competencies. But sometimes it just doesn't work. And we have to then separate. And that requires all the sort of standard stuff with a paid staff, real transparency, documentation, lots of engagement and conversation, which I won't waste lots of time talking about, but because I know others need to speak. But yeah, really, really difficult. But a lot of it is about transparency, maximum support so that we can try and avoid it. And then being very, very clear on why we've made those decisions. I hope that helps a little bit, but it's not easy.
Thank you so much, Nicola. Anything from Vita Plena's side on that? Anything you want to add, or do you feel like that covers?
I guess I would just say, like, something we mentioned in our group is like, so our team is right now, the direct service workers, they're paid, they're not volunteer community health workers, but we tried to we had like a very complicated pay schedule system at the beginning where like some you get kind of paid by activity or hours, and then we found that people, until we kind of made it more of like either you're half-time or full-time, people didn't take it as seriously and didn't kind of prioritize it, because we thought initially that the idea was like this will be more flexible to give people, they can kind of choose their hours, but it just seemed like it was always getting deprioritized. It was really difficult to schedule things. And so then we have kind of been slowly transitioning out of that to giving people more just like job security, full-time. And so that was kind of a learning in terms of how we set things up that way. Yeah, so we also, another kind of thing though with that is, mentioned in our group, is like the challenge of like training and the longer kind of like cycles around training and mentorship to get people up to the level where we want them to be, means that sometimes we have held on to people for too long. And so I think this has been a learning on our side, is like having to just like accept like the sunk cost fallacy, but you know what, we just keep throwing more at some people, and unfortunately it's just not a good fit. It's not going to be ever going to fit no matter how much we keep trying. So I think that was a little also kind of a learning of just the accepting of that. So,
but I think that'll be a really good thing to come back to and weave into our next session when we talk about supervision, and come back to Brian's point.
on a mini advertisement. The idea here is like everyone who's interested in this we wanted to make this about a 3-part sort of set practical knowledge sharing. So really very much focused on people who are in the field working directly with community health workers and mainly in mental health, and very much focused on getting in the weeds of like the nitty gritty of like how do you run these programs. So this was like selection. We also are thinking about, we'll take some interested to hear if there's any interest from different people in this group, but we're thinking a lot about supervision. What does that look like? And then preventing burnout from community health workers. How do we kind of care for them? What do those processes look like? And so just kind of a quick advertisement. Those will be coming up, kind of space them out over the next couple of months. And with a huge thanks to Catalyst now for helping just host and support all of this.
Thank you so much, Joy. And yes, some of these topics did come up in our discussions, like around burnout. So I think people would really appreciate the follow-up sessions. We are coming to the end of our session, so I apologize that we didn't have more time for questions, because I know we could have probably kept on going for much longer. But as Joy said, Nicola and Joy have kindly offered to do a kind of a series. So this is the first of a few sessions that will be coming up. So please do, keep tuned for when we put out the announcements for those sessions. We have another webinar coming up in April. Sorry, which month are we on? Yes, no, so we're in April and May. That is going to be on stigma, kind of an anti-stigma campaign that was run by both from England and Kenya. So we're going to have Sue Baker and Rosemary Gathara who are going to run that session for us. If you are not signed up, if you have just joined this webinar, but you would want to become a member of the Catalyst Mental Health Collaboration, please do drop Susan an email. Susan, maybe if you could put the Mental Health Collaboration email just there so people could get in touch with you. We will send notes from this session. I don't know if you've been following all of the chat, but there's lots of great resources that have been shared. Like Lauren from Demagi shared a few different links that you might want to look into. And we can also see from we can try to kind of build on this resource, to try to take notes from all the different breakout rooms that we will try to kind of put together. But I think that is it for now from us at Catalyst. Just a huge thank you to everyone who made this happen today. So Anita, Teddy, Nicola, and Joy, thank you so much on behalf of Catalyst. It was a great session. So good to have a practical topic that we can kind of get stuck into. But as we said, there will be follow-up sessions. So I hope you can join us for those as well. Thank you so much, everyone. Have a wonderful day, evening, morning, wherever you are. Bye-bye.
Thanks,
Thanks,
everyone.
Everyone.
Bye, everyone.
Bye,
Thanks,
everyone.
Etla, for leading us.
Thanks, guys. Appreciate everyone.
Thank you, everyone.
Bye.
Thank you, everyone.